a scenario for our discussion. A Parkinson's disease patient, a known case of 68 years old male with known case of Parkinson's disease, going for cataract surgery. Okay, so this is if you just want to think about it, that what can be the concerns. So they will be revolving around the physiological, pharmacological and anatomical changes with reference to elderly population. Okay, in some parts of world maybe 68 year will not be considered as a pure elderly patient, but still in our part of world it will be considered as elderly patient. So that will be challenges with reference to edentulous, maybe physiological changes like with reference to blunt cardiovascular responses, respiratory problems, fragile lungs, difficult IV, chances of delirium. Okay, altered pharmacological response to the anesthesia medications, things like that. So you can just use a word which is covering the all the changes in a compact way. Okay, and if they want to ask something in detail, they can ask you, but if you just make a sentence of around 30 seconds to 1 minute maximum about elderly, and you make it just your second nature, that any scenario with elderly patient comes and you are able to speak out for that. Okay, so elderly concerns with reference to physiological, pharmacological and anatomical considerations, making the anesthesia conduct challenging with reference to airway management, with reference to use of anesthetic medications, more chances of comorbidities with reference like cardiovascular or diabetic or anything like that. Okay, so the one part of this scenario will be with reference to elderly. Okay, the second thing will be Parkinson's disease. So Parkinson's disease, as you know, that it's a degenerative neurological disease in which the balance between the inhibitory and the excitatory pathway is not in there because of dopamine deficiency. Okay, so the result is there is inhibition. Okay, there is loss of inhibition and there is rigidity. Okay, so that is in the form of cogwheel rigidity or lead pipe rigidity, tremors, risk of aspiration, cardiovascular problems, and there is a big list of problems with reference to Parkinson's disease. So you can just chalk out few of them with reference to Parkinson's disease. And now when we will be jumping towards the cataract surgery, the problem will be that usually the cataract surgery is being done under local anesthesia, but here because of tremors, maybe that will become a challenging thing to do it under local anesthesia, because cataract surgery you need a very still surgical field. Okay, and if the patient is moving or patient has tremors, maybe they can manage, but maybe it will be a concern which you need to tell. Okay, and with reference to all the medications which these patients are using for the dilatation, usually these may not have much of interaction with Parkinson's disease medication, but usually the Parkinson's disease medications will be of your concern, that you should be knowing the medications which patient is taking for Parkinson's disease. And let us have a look on few of the things with reference to Parkinson's disease. Okay, let me show you. So you can just say that there is autonomic responses. Okay, tremors, as I told you, resting tremor, lead pipe rigidity and cogwheel rigidity, saluria, risk of aspiration, as I told you, and bladder dysfunction and depression and chances of this delirium. Okay, so this is how you should be taking in count a scenario. So one thing will be the patient identity. So coming back to what we were discussing, that if you have any scenario, think about the patient group, like whether the patient is elderly or pediatric or pregnant or things like that, then a disease, and in disease try to just say in few words what that disease is and how it is changing the anesthesia management, because they don't want you to tell the whole of the story leading to a PhD of that subject. they just want you to summarize, because the whole of the scenario for this will need only 5 minutes maximum in any exam, whether you are in FRCA or FCI or EDO or FCPS or MCPS. The thing which you will be needing will be only 5 minutes. So you have to, and they will be asking you all the aspects. Okay, so this patient will be in straight supine position. They need a pure static surgical field. So that will be that, maybe you need general anesthesia. So this is another thing with reference to surgery, is that you should be knowing what are the surgical concerns. So with reference to that, I will just show you a small document which can help you in chalking out any concerns with reference to surgery. Okay, here we go. So this is just a second, I don't know what has happened. Okay, so any surgery, you in any of surgery you are discussing, whatever in the viva, whatever the scenario based questions, there will be a patient population, there will be a disease, and there will be a surgery. So for surgery you should be knowing these things. Okay, what is the surgical urgency? Like if you just fit it here, it's an elective procedure, it's not an urgent procedure. Surgical risk, it is actually more with the reference to the globe perforation, or even if they are giving local for that thing, blindness and things like that. Okay, bleeding risk, this is low risk for bleeding. Even the patients taking anticoagulants, they are going for this surgery. Okay, patient position required, it's a supine position. And not only this Parkinson's disease, if the patient is not able to lie flat, as if in COPD, okay, or if any patient, if there is orthopnea, patient is not able to lie flat, that's a problem. Any patient with the claustrophobia, that will be problem with the supine position, with reference to cataract. So you will try to fit it all. Usual duration, it's around 30 minutes to 40 minutes maximum. Okay, level of this will not be valid in this surgery, but you should be knowing in all surgeries you are describing. Try to think about maybe you are not asked, but you should be knowing that what level of anesthesia, what level of incision, and possible anesthesia options, possible analgesia options, potential concerns. Like for example, if you are discussing any surgery in which there is tourniquet, so this is a potential risk. Placement of tourniquet, creation and reversal. So all the concern and tourniquet pain, and the hemodynamic and respiratory and metabolic and electrolyte imbalance and acid base imbalance which can occur with the reference to this thing. Okay, so I'm just giving you one example. So cross clamping or clamping is also an example like that. Similarly, any surgery in which there is one critical step, and when they are, if you are talking about laparoscopic surgery, insertion of trocar is a critical step, and pneumoperitoneum is a critical step, and then gradual absorption is a critical step. So things like that. Okay, so specific age group prone for that surgery, so this is elderly population usually. Okay, any specific equipment, location, staff, medication, logistics. So this is just an idea. In this scenario I took a little more time, but I hope you understand what is my aim. Thank you very much.